Hi, I'm Dr. Danny Shoat, a gastrointestinal surgeon here in Beverly Hills. Have you ever noticed that eating anything seems to trigger pain within minutes? I'm not talking about a specific food, but just eating in general causes pain. That's one of the hallmarks of a condition called median arcuate ligament syndrome, or MALS. Most people describe it as a tight squeezing pain right below the ribs, almost like a vice grip in the upper stomach or chest. It's not the type of pain that builds slowly over hours, it happens fast. For many, it starts just a few bites in. So what's happening isn't about the food itself per se, it's about how the nerves and blood vessels near your diaphragm react when you eat. As food passes through, that area can get irritated and the nerves around the celiac artery send out pain signals that feel sharp, deep, and immediate. Over time, people begin to adjust without realizing. They graze on small portions, sip liquids throughout the day, or even avoid meals altogether to keep the pain away. Now, that fear of eating can lead to dramatic weight loss and fatigue. If this sounds familiar, you're not alone and you're not imagining it. Understanding that this pattern exists is the first step to guiding the right diagnosis. The key thing to remember is that pain that strikes within minutes of eating, no matter what you eat, behaves differently than reflux or IBS. It's your body's way of telling you something deeper is happening.